You are not live.
Yeah.
Okay. So I'll just wait. Yeah.
Yes.
Welcome, Diane. Welcome, Tiana. Welcome, Choma. Don't live. You're welcome. Adenike, you're welcome. Luka, you're welcome. Jegede, you're welcome. Hawe, you're welcome. Rodin, you are welcome. Marvelously incredible, you're welcome.
Sorry.
Ibukun, you are welcome. Ebonla, you're welcome. Aligoni, you're welcome. Bimbo, you're welcome. Wachiri, you're welcome. Adebionma, you're welcome. Mervy, you're welcome. Femi Olaifa, you're welcome. Makafol, you're welcome. Good evening, viewers, and thank you for joining us. We're going to go live now to discuss the topic of the day, which is puberty in girls. The objective of doing this is to provide information for our young folks and our parents in the hope that information is power. Even for those of our young folks that have already experienced puberty, by the time we finish, we're done with this topic, they should be agents of information in their various communities. And for our parents, we want to provide directives and pieces of useful advice in taking care of our pubertal girls. So I welcome you to this forum, and I want to encourage you that after my talk, I will be having a session which is dedicated to taking questions so that we can answer and discuss the issues relating to puberty. So, as it goes, puberty is a stage in the life of an adolescent where she becomes physiologically and physically mature to the point of attaining reproductive capacity. This means that on attainment of puberty, the big changer is that the lady is capable of getting pregnant, while the boy is capable of impregnating a lady. Now, so this this comes with a lot of changes, a lot of in orientation, in body form, in body functions, and the way our teenagers look at life generally. So how does puberty happen? There are chemicals in the body called hormones. And in the brain, there are two important centers. The first is the hypothalamus, and the second is the pituitary gland. The hypothalamus is the command center and sends commands to the pituitary glands. These commands come in form of releasing hormones. What it does is to tell the pituitary gland at the base of the brain to release its hormones, namely or chiefly follicle stimulating hormone and luteinizing hormones. These two hormones then stimulate the ovaries. The ovaries are organs, glandular organs in the body, one on the left and one on the right, in the female pelvic region, or if you like, below the abdomen. And they are the custodian of the female eggs. So what the pituitary glands, follicle stimulating hormone and LH, that is luteinizing hormone, what they do is to stimulate these eggs in the ovaries. And the eggs begin to produce their own hormones, which chiefly is estrogen. Now, estrogen is by and large the dominant female hormones in the body and is majorly responsible for bringing about the changes in puberty. Now, so before puberty, this stimulation is at bay, but as the girl develops at about the age of 10, signals begin to pass from the hypothalamus to the ovaries to release these two hormones. And then they start by releasing little quantities at a time, and with time, these hormones become sufficient, and they are able to bring about, they are sufficient enough to stimulate the ovaries and the follicles, that is the eggs in the ovaries, to produce estrogen in order to stimulate the changes that occur in puberty. What are the changes? What are the features of puberty? I should say that at puberty, as a girl approaches puberty or attains puberty, the body becomes a battleground for hormones, as the hormones become increasingly secreted in amounts and in frequency. Now, the first thing to note that the parents should notice that the girl begins to grow rapidly. This is called growth spurt, and can gain about 3 centimeters to even 5 centimeters in a year. And this is the period that parents should be on the lookout for. The second is the appearance or the development of the breast. The breast that has been appeared like a board now begins to develop to female adult breasts. The third is that shortly after, there will be appearances of hairs in the private parts and the armpit. And all this will culminate in the appearances or the occurrence of the first menstruation, which is called menarche. At what age should we expect this? The growth spurt that I mentioned earlier normally happens at about the age of 9 years. The development of breast, that is breast development, adult breast development, starts also at about the age of 9 years. But first, this is preceded by the growth spurt. The development of hairs in the private part and the armpits starts at about the age of 11. And menarche, which is the appearance of the first menstruation, normally occur at about the age of 13 years. Now, let's talk about the what appears, the physical appearances that may herald puberty, that the patients will actually be able to recognize if they have information. Aside from the fact that of the female's, growth spurt, which means that there will be accelerated tallness. The lady begins to grow, and people that maybe saw her maybe a few months ago say, "You've grown," and everybody notices that he has grown and is becoming more and more mature. Then, because of the appearance of these hormones and their effects, the lady may experience, start having pimples, things like pimples, stubborn pimples on the face, weight gain. Most girls, about 90% of girls would experience weight gain during puberty. And then girls being who they are, some of them may not like this, some may be embarrassing, and they may resort to being secretive. And parents should really watch out for this and be understanding, because these changes are physical and other people can see them. Some people will comment on them, maybe wrongly or in a way that is judgmental and all that. And of course, at puberty, because there are physiological and emotional changes, at puberty, many of these young adolescents would experience the first intense emotional feelings towards the male gender or boys. And this also is another area where they need to be guided so as to know what to do. Now, having said that, I would say that generally, globally speaking, the age at which girls attain puberty is reducing, and that is the world over. And I should say also that this age, doctors have suggestions as to why this is so. One of the suggestions is that puberty also depends on racial groups. That is, whether you are black or white. It's been documented that among the racial groups in the world, black girls attain puberty earlier than other races. Even in America, black Americans, African Americans attain puberty earlier than the other racial groups. Other things that have been adduced or suggested is lifestyle indulgences and changes, especially regarding diet. It's been suggested that diets that promote fatness or obesity, fatty food, sugar, and excessive meat can accelerate the attainment of puberty. Opulence, when your parents are rich, you have everything in surplus, you eat more, you get fatter, and all that, you are likely to attain puberty earlier. Nowadays, still on lifestyles, you have situations where people use hair attachments, whether natural or artificial. These attachments have been treated with chemicals that contain estrogen. And like I told you, estrogen is the chief moderator in terms, that brings about puberty. So when you have situations where little girls are wear hair attachments that have been treated with estrogens, when such hairs or attachments come in contact with the skin in the neck or their scalp or their upper back, the estrogen finds its way into the body system of these young kids, and that may accelerate their attainment of puberty. So parents should note this, that allowing little children to wear attachments impregnated with chemicals that contain estrogen can lead to accelerated puberty. So what are the variations? I've just described normal puberty, but then there are other variations which may not necessarily constitute diseases, but they happen. So the age at puberty normally, globally now, is between 9 and 14 years. Therefore, but we have people that actually attain puberty before the age of 8 years. Now, for such people, doctors would say they have early puberty or precocious puberty. Some other people at the other extreme attain puberty later than others, and we say they have delayed puberty. So therefore, precocious puberty means that a girl has attained puberty that has shown features of secondary sexual characteristics, that is growth spurt, development of the breasts, growth of hair in the pubic and the armpits areas, development of female body contour. And I want to add that at puberty, because of the activities of the hormones, the estrogen and other hormones, the sweat glands becomes more active, and this brings about body odor. So many girls will be having body odor for the first time when they attain puberty or they are undergoing the process of puberty. And this is why it is possible for a caring mother to smell the clothes of her daughter and recognize it. What I'm trying to say, therefore, is that at this point in time, girls develop body odor, but this body odor is not the bad body odor that constitutes offense. This is just physiological. Now, so what are the factors that brings about precocious puberty? Now, for 70% of cases, the reasons for developing precocious puberty is unknown. The doctors will tell you they are idiopathic. For the rest, there are suggestions. The first is that in some communities, there are possibilities that people in these various communities will develop maturity earlier than other girls in other communities. That is to say that there's earlier attainment of puberty. That is, precocious puberty is more common. Also, in some families, it is not impossible that in a certain family, in a community, girls tend to develop faster or mature faster than other people in the community. Again, precocious puberty is commoner in the black race than the other races. That is, in the African Americans, there are more adolescents with precocious puberty than other racial groups. And like I said, again, extreme stress in childhood, insulin resistance in childhood, opulence in childhood, obesity in childhood, and some other endocrine problems like thyroid problems can lead to precocious puberty. Infection of the brain, meningitis in childhood, growth in the brain, and a set of people that live in the lower altitudes or near the equator. For example, people in Kenya, people in the Republic of Congo, and so on and so forth that live near the equator. This is not the case in Nigeria anyway. We expect them to experience puberty earlier than the others. Now, what are the challenges when one attains precocious puberty? Now, remember that these girls, they are young. They attained what their counterparts normally attain at 9 years and beyond. They attain at 8 years. That opens a whole world before them, and with consequences. Now, well, what are the challenges? Aside from the normal challenges of puberty, these girls are now, because they are young girls, but they appear older than their chronological age. Therefore, since they are mature, if parents refuse to recognize the stage they are in and guide them accordingly or protect them with love, they are at the mercy of sexual predators from older boys or even men who may want to take advantage. The second is that because the height that an individual attains in life in terms of tallness depends also on the growth of the long bones. In the case of precocious puberty, the long bones stop to grow earlier than normal, which means that because of this stoppage of growth in the long bones, precocious adolescents with precocious puberty are normally short. As a matter of fact, the documented height for precocious pubertal girls is about 5 feet. So they are short, they are fat, and this is a problem. The third is that because of their disposition, remember they are very young, even though they look older than their age. Their IQ in terms of intelligence is roughly the same as their age. So this is a disadvantage because one would expect that they are able to protect themselves with the special condition that nature has physiologically endowed them with. But the fact is that they are young at heart and they will behave their age. So they are at special danger of excessive probing from sexual predators, from men that will want to take advantage of them. Remembering also, not forgetting that they are being put in a position to cope with the age and functionality and reasoning that they are not prepared for because of their chronological age. Now, like I said the other time, at the other extreme, you have girls with delayed puberty. Now, when a girl or an adolescent is 14 years and has not shown evidence of secondary sexual characteristics, parents should wait, and in the hope that this will appear and the growth will be normal, the development will be normal. But if by the age of 16 the girl has not menstruated, then you should take your girl to visit the doctor. What I'm trying to say is that it is possible for such ladies to have delayed milestones. So at 14 years, some would have some secondary sexual characteristics, but they have not menstruated. You wait for 2 more years. At 16 years, there are secondary sexual characteristics, but he has not menstruated. You need to see a doctor. This may just be unique or familiar or normal for a particular child. But I'm sure that parents, especially our mothers, would worry about such developments. So what I'm saying is that by the age of 16, the doctor should be consulted, because the fact is that when excuse me, for those people experiencing precocious puberty, also once they are noticed, the doctor should be consulted, because when the treatment is started early, the milestones can be delayed, because the milestones are accelerated, remember, because they are precocious. So doctors have a way of delaying those milestones so that the growth of the lady, especially the growth of the bones, is not arrested, and the girl can still achieve the normal height, and menstruation can still be delayed until the girl falls within the normal pubertal age group, which is 9 to 14 years. For delayed puberty, the commonest cause, about 30% of these cases, the cause is unknown. But aside from this, the commonest cause that is doctors have diagnosed over time is a syndrome called Turner syndrome, which comprises of which are found in girls. These girls are usually short. The neck is usually fat and webbed. When I say webbed, that is they are wide. The chest is wide. The breasts are small, and they come to the doctor most times because of the fact that they have not experienced menstruation. And many a times for such girls, depending on the degree of this syndrome, these girls do have vagina, but the vagina may be shallow, and many of them do not have ovaries. In most cases, the ovaries are very small, and the female eggs there are very immature and scanty. And remember that I said what I said about menstruation, that it is these female eggs that produce estrogen. Estrogen is the main hormone that drives puberty. So what I'm trying to say therefore that is that most of these girls will not menstruate. They come with what doctors call amenorrhea. That is, they will complain that, doctor, I have not seen my menses, I'm worried, I've not seen my menses, or they are now at the age of marriage and all that, and they've been experiencing, because they have not menstruated, so they cannot conceive and all that. And depending on the degree of this syndrome, they can present in various ways. Nevertheless, if you visit your doctor, especially you get a gynecologist to listen to you, examine in company of your parents, these conditions in some cases are treatable. Remember also now that since the uterus is usually there, it's only the ovaries that may be compromised, which means that they cannot produce eggs on their own. And if you cannot produce eggs on your own, that means that you cannot get pregnant naturally. Now, if you go meet a gynecologist, and they have examined you, and you have uterus, you have vagina, you have the normal uterus, and all that, you can participate in an IVF program, or other programs like intrauterine insemination, where the doctor you can participate in an IVF program where people donate eggs for you, and the embryo is grown in the lab and put into your womb. So depending on the degree of this syndrome, the doctor would fathom out treatment strategies for you. I think I have said, by way of introduction, I've talked about puberty. There's no way you're going to talk about puberty without talking about adolescence. But I would say that adolescence represents a broader spectrum in terms of timing, length of time, all right? And also teenagers. But puberty is just a section, and I'm sure in the subsequent sections, by the grace of God, we'll have time to also discuss adolescence and problems associated with the teenage age group. Thank you very much. This is my way of introduction, and I think now we're in a position to take some of your questions. I want to make this as interactive as possible so that we can share experience, because experience is better than mere teaching. All right. I want to take some of these questions now. The first says, how do we know hair attachments impregnated with estrogen? Unfortunately, there is really no way. What estrogen does to a woman, and that is why you look luxurious. When you have plenty of estrogen, you look luxurious, your hair is shiny, it is long and everything. And that is the main difference between a man and a woman. All right, so those people that sell these things as hair attachments also recognize the fact that they need to polish it. All right? And one way to polish it is to impregnate it with chemicals that will make it shiny and as natural as possible. So when you see, if you are using any hair or any attachment, there is no veritable way or verifiable way to know that it has been impregnated with estrogen or not. But my take on this is that if you are going to use attachments for girls, they should not be very young girls. All right? Don't use attachments for girls of 5-6 years in the name of fashion, please. And our parents should please take note of this. What are secondary sexual characteristics? I think I did mention those. Growth spurt, that is acceleration of tallness. That is the very beginning. Then development of adult breast, followed by, that is, normally this happens at the age of 9 years, the two of them, but the first is the growth spurt, followed by development of the breast at the age of 9 years also. Third is the growth of hairs in the private part and the armpits. This comes at about the age of 11. And the last is the appearance of the first menstrual cycle, which doctors call menarche. This comes at about the age of 13 years. But like I told you, these age brackets are declining the world over. And they are more accentuated with the black race. Even where you have mixed races and you have white and black, when black African Americans will still experience these secondary sexual characteristics earlier than the other races. Third question: what is the relationship between pubertal abnormalities and infertility? So, when a child is developing, so many things can go wrong. All right? For example, let us take delayed puberty. Delayed puberty may mean that the child has delayed milestones. But it may also mean that development is not totally normal. For example, in the case of Turner syndrome that I told you about, I told you that these girls do not have good eggs in their ovaries. The ovaries are very small, the eggs are very abnormal. So such girls cannot produce eggs. If you cannot produce eggs, you cannot ovulate. If you cannot ovulate, you cannot fertilize. That means that you cannot on your own get pregnant. All right? Then, so that is a relationship between puberty, in this case delayed puberty, and infertility. And many others do occur. For example, if the woman is not ovulating regularly, then pregnancy is difficult. Let me say this. For a woman to get pregnant in a cycle, it will be such that that pregnancy must occur within the first 12 to 24 hours of ovulation. Because the female egg is viable for 12 hours, and for each hour that passes by, the quality reduces. It is such that if the sperm produced by the man does not come in contact or fertilize the female egg within the first 24 hours, pregnancy cannot occur. All right? So, in various ways, puberty affects fertility. Third question. Another question. I started my menstrual period late, and I discovered that daily use of familiar... What?
The constitution is there.
Okay, I discovered that I enter menopause as early as 41. Can you please explain? So, the average age of menopause the world over is 51 years and 4 months, and is being noted. Let me give a background. Menopause, every woman would eventually experience menopause. Why? Because the eggs inside a woman is not inexhaustible. By the time a woman is born, that's a female girl is born, the girl has about 2 million eggs. All right? And the girl begins to grow, such that by the time the girl attains puberty at about the age of 9 to 14 years, the number of eggs in her has reduced from 2 million to about 500,000. You can see the difference from 2 million to 500,000. What I'm trying to drive at is that every month that passes by and the woman menstruates, she uses up the eggs. Unfortunately, the tendency is that you use up your best eggs as you get older. That is to say, it is more likely that the eggs that you used for the last cycle are better than the eggs that you use for the present cycle and subsequently. And as you grow older, therefore, you have fewer eggs. All right? And aside from the fact that the eggs are now fewer, the one left behind are the ones that are likely to have genetic anomalies, especially what we call aneuploidy, which means that they are not good. All right? So what I am trying to say is that it depends on the as you grow older, you have less eggs. Okay? And it is these eggs that produce the hormones in sufficient quantity that sets the cascade of your cycle such that you bleed and you say, I've menstruated every cycle, right? But it gets to a point when those eggs are no longer sufficient in numbers and in quality, and so they cannot bring about menstruation anymore. Okay? And therefore, when a woman stops to menstruate, we say the woman has entered menopause. The issue here is that in this particular case, you probably run into what we call ovarian insufficiency because of reduced number of eggs and poor quality. I need to say, however, that this is not unusual because every woman is an individual. In this case, for your age, if you entered menopause at about the age of 41, then you are said to have entered menopause early. That is early menopause. All right? Premature menopause or early menopause. But there are causes, there are reasons why you can enter, you can be in this type of situation. For example, aside from the fact that you might have used up most of your eggs, also the ovaries may fail. That is, remember that I said that the ovaries has to be stimulated by hormones from the pituitary. Now, if the ovaries do not respond to the hormones of the pituitary, there is no way you can have growth of the eggs that would eventually lead to ovulation and menstruation. So if you have ovarian resistant ovaries, that is, they are resistant to stimulation, or you have failure, and there are many cases, there are many reasons for a woman why a woman can have ovarian failure. It starts from you can have failure as a result of genetic issues, But more commonly, you can have failure as a result of the environment. The environment you are in, what you use, the drugs you take, the exposure you have. For example, if you are exposed wrongly or for a prolonged period to irradiation, ionizing radiations, they may destroy the ovaries. And once they destroy the ovaries, you will have you run into menopause. This is called artificial menopause because it was induced because of your exposure to ionizing radiation. Also, some patients, some women may be undergoing treatments, and the drugs they are using is so that will affect the functions of the ovaries. For example, if you have been placed on drugs that are used to treat cancer, cancer drugs are targeted against cells that are actively dividing, which include the ovaries. So they may also destroy the ovaries. So there are other things. Recently, there was a litigation by Johnson & Johnson where because some women have been using talc, mentholatum powder, and this have found its way into the ovaries and destroyed the ovaries of some women and caused cancer. Some of them had dysfunctions. So there are a lot of reasons why a woman may enter menopause at early age, like you did. Wow. Are there changes in the male child? If yes, what are these changes? Well, I'll just try to answer this, but we are not discussing the male child here. Also, male children experience puberty. In fact, every species, before you can procreate, you must first attain puberty. And in the same process, the only difference is in the type of and the level of hormones. There are male level of hormones that are responsible, but puberty is higher in females. It's about 5 times faster, in females than in girls. And in males, they also have accelerated growth. I mean, like the girls do. We all have development of breasts. In this case, the breast is not as big as in ladies, but you will notice that there is a enlargement of the breast. Some would appear as if they are painful, they are developing. Most times, the 2 breasts will be involved, but sometimes you have just one breast developing. That is rare. We call this so this breast development, this enlargement also happens in males, and then they also develop hairs in the private part and the armpits. Of course, with males you have secretion of male hormones, which gives the boy a deeper voice. All right, you notice that the voice has changed to a more matured something, maybe resembling now that of the father and all that. So a boy that is undergoing puberty, the mother may mistake the voice with her husband. So, and then of course development of the genitals, the pubic hair growth in the armpits and all that. So this still occurs in boys also, and we should be on the lookout. The issue here with boys is that they don't face the same type of challenges that a pubertal girl faces, because boys don't get pregnant. All right, they can run into problems of adolescence and peer group and other social issues because of their aggression and the nature or the masculine nature, like involving in pornography, in drug addiction and all that, which are less with females. But then they also have pubertal challenges. Next question. For a young girl of 7 years with breast, please, how can one differentiate fatty breast and adult breast? So, like I said, the breasts of young girls, whether young or not, I said in my my introduction that if there is development of the breasts, all right, and other secondary sexual characteristics before the age of 8 years, the girl may be undergoing precocious puberty. I would advise that you take this child to a gynecologist for complete examination of the other parts to ascertain whether this breast enlargement is actually due to precocious puberty or not. And you have to look into your family, especially yourself as a mother, whether you also started such developments and whether it is familiar, that is, it runs in the family, especially if you have other siblings. If you don't have such and the girl is not sick, please, this may mean that this is physiological, that it's a normal function, but you still need a doctor to differentiate whether this is a fatty breast or an adult breast. By and large, people at the extremes of life, especially those that have entered menopause, have a lot of fatty tissues, because the glands and the fatty and connective tissue proportions are now dissimilar. That is, we have less glands that are producing breast milk to the proportion of other tissues like fat, like connective tissue. Connective tissue is the one, connective tissue and the glands in the breast that secrete breast milk, they are the one that makes the breast to maintain its contour and to maintain its rigidity or turgidity or the texture. But when you have attained menopause and the breasts are no longer, the milk is no longer remarkable, the breasts are no longer as big as it used to be, they have shrunken, then you have more of fat and connective tissue, okay, as opposed to when you are at the middle age. My daughter is 10 years. She has hair on her private parts. I think this is in conformity and within the age group of puberty. But if you are worried, again, you have to look for other signs of puberty. Check the breast, check the armpits. Has he gained weight? Is he now has it had accelerated growth or growth spurt? And is the overall appearance of the girl, does it look like a matured girl or a young woman, and so on and so forth? Has he started menstruating, and all that and all that? All these questions you need to ask, and if you are still in doubt, please see a gynecologist. But I want to say that at 10 years, you expect her to, it is not bad if she has hair on her private part. I said that such growth should be from 11 years, but this age group, this number is not cast in stone. It is sometimes individualized. Question, I want to ask, does it mean that it is risky using attachment for kids? Yes, it is risky using attachment for kids, especially, like I said, from the age of 6 years and below. It is risky because those attachments, they will fall on the skin of the back of the chest, they will fall on the skin of the neck, and they can also fall on the skin of the scalp, that is the head. And the skin is like a table tennis net. Many things, like even the grease that you use, the cream that you use, percolates and passes through your skin into your body tissues. So the estrogen in these attachments can get into your child's body system. And since there is no sure way of knowing which one has been impregnated with estrogen or not, it is safer to keep away from using these attachments on young kids. Is there a possibility of repeat broadcast for a parent not available online? Yes, this broadcast will appear on my Instagram, on my Twitter handle, and on the YouTube. So you have a second chance. But next time, I would prefer that you attend live so that you can have the opportunity to interact and ask questions so we discuss. Sir, is it advisable for a girl of 15 years to donate eggs? This is not advisable because egg donation is a decision that should be made in full consciousness and with legal qualification. Any lady that is less than 17 years should not donate eggs because it is assumed that she is not up to the age of taking legal decisions. Anybody that does that harvests eggs from a 17-year-old girl is doing so and can be accused of child abuse and professional recklessness. So it is not appropriate if you are 15 years to donate eggs. Wait until you are 18 and above because you need to sign a consent. And the consent says that will ask you whether you are 18 or above. Your age must be stated. And then tests must be conducted that you are actually fit to donate eggs. There's no harm in donating eggs, but then you must be mature enough to take a decision as to whether you want to donate eggs or not. Can early puberty be related to the reasons why ladies at their 20s look like nursing mothers with large bums getting fatter at each passing? Well, this may not be adducible to early puberty, but there are many other causes why ladies can look the way you described. But I think the least of them is puberty. There are many other reasons beyond the scope of this discussion. Question: is it normal for a 13-year-old girl yet to start menstruating? Yes. Like I told you, the age at puberty now is between 9 and 14 years. So 13 years falls within that age bracket. And if there is no abnormality or problems, this may be perfectly normal. Please, what is menopause? Well, like the word implies, even though we are still going to have a session on menopause, but like the word implies, it means the menses has stopped. The menses has stopped. That is, a woman has stopped menstruating. All right? So menopause, simply put, means the woman is no longer menstruating. That is, meno means menses. Pause means to stop. So menopause means the menses has stopped. And like I told you, the average age at menopause is 51 years, 4 months. Does that mean, question, Doc, does that mean quick ejaculation started from puberty in the absence of infection? This is not so. There is no relationship with puberty and ejaculation. When we talk about sexuality, I think this type of questions will be taken. We'll be taking questions on sexuality, sexual intercourse, and all that. Then you can have the opportunity to ask me these type of questions. Are there changes in the male child? If yes, what are these things? Okay, I've answered that. What is the meaning of syndrome? All right, so a syndrome